of Tourism for the city of Southport. Kira, come on. And I'm going to welcome everybody today. And I also want to introduce my niece, Lexi Jones. She's a sophomore at Southport. Freshman. Oh, I'm sorry. She just had her 15th birthday Friday, and she got her learner's permit. So I'm actually I'm in a state of shock right now. But we want to welcome you today. Our topic is going to be on Dr. Dosher, the quarantine station to the hospital. And I want to kind of actually here, because I want to kind of show Lexi off and kind of, she did this project for the high school history. I want her to explain that project, what she was involved in, do this, and then I'm going to fill in some blanks and tell a little bit of the story of how the hospital developed. But I'm kind of just a proud uncle right now. So.
My name is Lexi, and like he said, I'm a freshman at South Brunswick High School. So around October, my history teacher introduced me to a newly introduced club at our school called National History Day. So National History Day is, it gives opportunities to students who are interested in history to focus on an event in history and connect it to the topic of the year. This year's topic was triumph and tragedy. The topic changes every year. When I was researching and finding events to focus on the triumph and tragedy, I really wanted to focus on family history and include my great-great-grandfather, Dr. Dosher, and also the local history of Southport. So after that research, I found that the quarantine station connected to the triumph and tragedy. So the obvious tragedy in this situation would have been the spread of the infectious diseases, which caused this spread of disease was during the Civil War, many travel regulations were dropped. So the ships that were, that had to stop at these quarantine stations no longer did because these regulations said that the soldiers and the citizens of the Cape Fear needed resources, and so all these diseases such as yellow fever and smallpox were able to travel through the Cape Fear. So now the Cape Fear had this tragedy, and then they needed to fix it. So there were small quarantine stations developed in the Cape Fear at the time, but they weren't very effective. So the U.S. government became involved in Wilmington and Southport. They began to raise some money, but it took a little bit of a process because Wilmington was a little unsure about putting their money towards this. So the quarantine station off the coast of Southport, the U.S. quarantine station, was developed, and this is a little model I made right here of a quarantine station. And it saved many lives of the Cape Fear. And actually, here are some grave stones of some of the victims of yellow fever in Southport. You can take a look at that a little bit later. So I'm going to move into how these patients were helped, and a big part of that was Dr. Dosher. He was one of the post physicians at the quarantine station. Not only was he a post physician, but he was actually one of the only physicians in Brunswick County at the time. One of his most memorable procedures that he ever performed was on a little boy who needed brain surgery. And I think he performed this brain surgery on a kitchen table. And at that time, these types of surgeries weren't well performed at all, and patients like that would not have survived. But miraculously enough, Dr. Dosher performed the surgery as a success. He also performed many other surgeries at the quarantine station itself. So that played a major role as being a health triumph in the Cape Fear itself. Dr. Dosher's big effect on the community ultimately led to the Dosher Memorial Hospital. So now I'm going to turn it over to my uncle to talk to you a little bit more.
Great, yeah. This is part of the history project. This was her school's it was part of the school she was one of the place winners for that, and she went to the state with this. So, what I'd like to do a little bit with this time is not only talk about Dr. Dosher, because he is a native of Southport. He was born in 1878. He was the son of Julius Dosher, who was a river pilot and a blockade runner. So he was one of 5 children that have family throughout this area. So he is, I kind of think, if I look at the history, blockade running and the Civil War and what that brought is probably what gave the money for him to be able to go to college. He went first to the University of Maryland's School of Pharmacy and graduated in 1903, and then the University of Maryland / Johns Hopkins at the time. In 1903 he graduated. So his choice after graduation was to come back to Southport. What he brought was not only the knowledge of being a physician, he brought a wife. He married Grace Keyworth, who was a socialite in the Eastern Shore of Maryland. It was his roommate's sister. So he brought her back to Southport, which I would imagine was probably a big culture shock for her to go from parties on the Eastern Shore and all that to little old Southport. But from what I understand, she adapted very well and really was instrumental in making a lot of things happen in Southport within the society. So I'm very proud of that. But with Dr. Dosher, he worked from 1903 to 1917 when World War I broke out, and he ended up going to France. He was part of the corps there that took care of our soldiers. Prior, as I say, from 1903 to 1917, he had a small office in his home on the corner of Atlantic and Moore Street. He had a basement office where he kind of performed his surgeries, took care of his patients. But it was also a time when Brunswick County had about 17,000 people. It was a very rural area. He basically was what we would call a horse and buggy doctor. He would go around and take care of patients from this end of the county all the way through Shalot, Leland. He was kind of one of those doctors that kind of took care of everything. I mean, we talk about a general practitioner. He really was. He would go out and do everything from deal with the disease to help take care of a delivery of a baby. So he was very versatile, which you had to be in those times. He was one of those doctors that kind of was a jack of all trades. And a lot of things happened during that time that he saw the need in this area for health care. As I look at his mission as a doctor, it was about community and about taking care of your neighbors. Because when I talk to people about this history, one of the things that he did was he never really worried about getting paid. He had a farm out, which is kind of funny if you think about it, where the Catholic Church is, and what is now Providence Home was the family home out in the county. That was what you would call, that was out of town. This town pretty much at that time ended at, easy to say, where the ABC store is. That was town gate. That was where, and it was a town gate there. That was to keep the animals out. So when you hear people joke about we need a gate again, we already been there, done that. So we always think about his early days when he chose to come back here and make a part of his own community. He saw from watching his, fellow residents and people of Southport that they really relied on him. There was childhood disease. There was a lot of things that were going early on in this type of rural community that he knew he could make a difference. And I always think when he went off to go to World War I, that it was a choice because not only he was 42 years old when he went over there and left his family and decided that he really wanted to make a difference there. And my dad told me a story that when he was working at Sunny Point, he always would throw an oyster roast for his fellow workers. And one of the oyster roasts, the gentleman came up to him and they were chatting. He was a guy from Varnumtown. And they were just talking about different things. And he heard that my dad was from Southport. And he asked him, he said, "Oh, Southport, do you happen to know Dr. Dosher?" And my dad laughed a little bit and said, well, yeah, I grew up with him. That was my grandfather. And he went, oh my gosh. He said, you're not going to believe this. But I went over to France during World War I, and I got shot. And they took me to this infirmary in the middle of nowhere. And I'm sitting there, not sure what was going to happen, scared out of my wits. Here I am from middle of nowhere, North Carolina, and I'm in the middle of this tragedy, for lack of a better word, for World War I. And all of a sudden I look up, and there's Dr. Dosher. And he said, and I knew I'd be okay. So I think that says a lot about him, that he affected the whole community. But after World War II ended in 2019, he came back. And one of his first jobs was as the assistant surgeon at the quarantine station. And I think there's a couple of stories there that I'd like to relay. Not only the one about Winslow, which was the young boy who, to expand on the story a little bit, when he was 8 years old, he had was hit in the head by a bat by one of his playmates. And for 8 years, he would get these constant headaches, have seizures, go through all this traumatic kind of reaction. And he went to all these specialists. His father was a financial advisor for J.P. Morgan out of Boston. So he went to all these big doctors, all these specialists trying to figure out what to do. And they couldn't really find the answer. So every year, one of their recommendations was to leave Boston, go down to Florida, and let him kind of recoup down there. It was all, the environment was very good for his seizures. So he would take the family, they would go down on the family yacht down to St. Augustine. And on one of the trips, they stopped here. And in that time frame, they actually stopped at the quarantine station office, which I'll explain in a minute. And when they stopped, they met Dr. Dosher. And he became friends with the young boy. And his name was Peter Winslow. And they became kind of buddies over everything, what he was going through. And after they were in St. Augustine, he had a really major episode. So the family was rushing back, you know, thinking to get back to Boston and see what they could do. Well, the son insisted on stopping here. He said, let me see Dr. Dosher. He says he can help me. So that's where the story goes, that they ended up at the house on Atlantic. And the legend is that in the office itself wasn't big enough for the procedure, so they took it to the kitchen. And it literally was on the kitchen table that he did this major brain surgery and relieved whatever was going on with the pressure, whatever it may be. He was here for a week recuperating. He lived to be 62 years old.
That's awesome.
So, it's amazing. So he, that was just one example. When I'm talking about the quarantine office, if you look at the end of Atlantic and Bay Street, the new house that's going up there, yay. Turn down from that, you'll see a, kind of behind these trees, you'll see a little white house. That was actually the quarantine office, the mainland office that was there. And that was probably what we would consider our first hospital. Because when he wasn't on the quarantine station here out in the middle of the river, he would be in that office taking care of patients. And one of the stories that would go around was during that time, he and his nurse, who happened to be a young lady that he met in France, one of his nurses there, and she ended up coming back here to be his nurse here through the time of not only the quarantine station, but when the hospital was open. So they would, on possibly 1 or 2 Saturdays a year, would get the word out in the county that he was doing tonsillectomies. So all of a sudden you would see 30, 40 people on a Saturday morning in line, and that's all we do all day long was take tonsils out. So it was truly the first hospital for Southport. So he worked towards that till early 20s, 25, we did see the need for a true hospital. So what ended up happening, we also started with a county-wide health department. And there was a big push from the health department to figure out how we could get a hospital in Southport. So between the health department, the message of Dr. Dosher, what he had done in the community, the Duke Endowment at the time, which James B. Duke, he was starting a new program to help rural areas get hospitals. So part of the idea was Winslow family and J.P. Morgan was able to talk to the Duke Endowment when the health department went and asked for Southport to be considered as part of this grant program, that they kind of put us at the top of the list. So we did get approved about 1925 to be part of the Duke Endowment, which was very interesting because it was one of three parts that led to the hospital. It was $15,000 from the Duke Endowment, $5,000 from the county, and $5,000 from the city. So for $20,000, they were going to build the hospital. And in 1929, they started. By 1930, they realized they needed a little more money. Oh, it was a tough one. $5,000 more to get the hospital completed. The county and the city matched and were able to get the funds that were needed. So by 1930, we were able, June 2nd, to get the doors open to the first Brunswick County Hospital. Wow. So again, when you look at it, for that amount of money, we actually had a full functioning hospital. And with Dr. Dosher, he was able to also go to Maryland, and the majority of the equipment was donated from the University of Maryland, Johns Hopkins. Almost everything were personal favors to him. So we were able to get all the equipment needed at the hospital and get it going. So we were very lucky with that. So the early days of the hospital, it was 2 doctors and a staff of 5. Wow. There were 20 rooms, so it was average, they would say 40 to 60 patients a month. So the early days, you know, and again, it was a situation they handled everything. If it was births to whatever it may be, it was a catch-all hospital. And it went very well in the early days. What ended up, a couple major factors was when Dr. Dosher was in France, he developed tuberculosis. So he started to get really sick in the early 20s as they were opening, getting everything ready for the hospital, or late 20s, and then when they opened the hospital, he was able to work on it for about 5 good years before he started to get sick. He would go to the mountains of North Carolina, to those facilities there to kind of recoup and get his energy back up, come back down and take care of people here. So he did this till 1937 when he finally had to retire. And he lived 2 more years till 1939 when he finally succumbed to tuberculosis in January 2nd. And in January 14th. In June 2nd of 1939, they changed the name of the hospital from Brunswick County Hospital to the J. Arthur Dosher Memorial Hospital. So that's kind of where we ended up as as his hospital, as we call it. And in those early days, it truly was a community hospital. It was neighbors taking care of neighbors. You had, yes, you had a full staff of doctors and nurses, but it was also neighbors going in and making sure everybody had what they need. And I think that's reflective through the years. The hospitals had a lot of transitions, a lot of growth issues, and I think as you look through the 30s, 40s, 50s, the hospital itself had economic problems, a lot of things that some days you didn't even know how they'd keep the doors open. And that's when we developed our volunteer program, our Pink Ladies as they were known. And I'm very proud to say they've raised over $1 million+ for the hospital since they've been developed. So I know that's just an example of where the community's played a part in it. But I always, as I say, we've kept through the years, but the biggest time frame for the hospital would probably be the early 70s. Because as the county grew, one of the biggest things we were finding is that Southport at the time was the county seat. During the 70s, they moved the county seat to Bolivia, and at the same time wanted to move the hospital. Oh, yeah. So for those aren't familiar, in the early 70s, there was a big push to move it. And they voted in to do the county hospital, rebrand what we were and put it out on 17. In fact, the building's still there. It's that white hospital that you see on 17 heading to Charlotte. That was built in the mid-70s and was to replace Dosher Hospital. They were going to close the doors, take away the county funding, disband the board of the trustees, and send everybody to the middle of the county. That's where the citizens of Smithfield Township voted in a bond referendum and said, no, we're not going to let that happen. This is our hospital. We're going to protect it. We're going to make it our hospital. So in 1976, there was a major bond referendum where 4 cents on your dollar of your tax money would be going towards the hospital. And it passed. One of the things I read recently and didn't catch me, a year later they found an issue with some of the formal vote that they had to do it again because there was a major group of people that thought, oh, okay, we're going to beat this, we're going to try again. They tried and it passed again. And we've done 2 votes since then from Smithfield residents. In case you're not familiar, Smithfield is our district that encompasses Southport, Oak Island, Bowling Springs, Bald Head, and a portion of St. James from the Players Club over. So it's just a small, that's the people that are paying the tax for the hospital tax. And the vote will be coming up in a few years to see if we continue that. That tax, I always like to explain that to people. I'm on the Dosher Foundation, and a lot of people are not quite familiar with what that tax does. It is a brick and mortar, a capital tax. It's only used for improving the facility, things that are for the facility. It can't take care of paying doctors and things like that. It's actually for the structures and for things that go in the buildings. I always like to kind of give people that idea exactly what the tax money is going for. But as I said, in the 70s, we took true ownership of that hospital. Board of trustees are voted on by you, the residents of Smithfield Township. It's we have a voice in it. We have it by not only our communications with the board, but by our vote. So I think that truly makes it unique. It's only one of 2 township hospitals left in the country. So we are very lucky with that. And it's always a challenge. I sit in a lot of these foundation meetings and hear about the change of health care, how it's always Medicare, all these things that play a factor in to where health care is headed. And I know with us, it's a true challenge to see surviving every day as a hospital. But we've been very lucky. We survive. And I think the time frame of learning about what we are as a hospital to where we're as a hospital to where we're going, I think we're something to be very proud of. It's our hospital. And I think we've got an ability to really sit down with this kind of pride that we have as a resident of this area and know that that hospital is for us. It is a community hospital. It's a situation where it's only as good as what we make it. And we can feel that if we partake in the voting and getting our information into it, we can have a part. So I thank you for making it our hospital, and please get involved. Make a point of learning about it, what's going on there, and it's how we make it better. So I thank you on that. I want to kind of open it up and see what you guys want to know about, if there's questions and things, because it's a lot of history here. Yes, ma'am.
On the quarantine station, talk a little more about where those buildings were actually located.
Sure.
And what the different buildings were.
We'll do it together, because by the way, this is a soccer accident. She's a trooper. At Dosher. At Dosher.
So the quarantine station was off the coast of Southport and the Cape Fear River. So it was, I think, like 2 miles?
Yeah, basically, if you look out, if you're on, let's make this easy. If you're at Kingsley Park on Bay Street, look over to your left, you'll see what looks like a small brick structure in the middle, a concrete structure in the middle of the river, that would be the water tower. That's the base of the water tower. The rest of the structure was destroyed in 1953 at a fire. So all the buildings were destroyed, but it truly was a city. And but it was multiple piers that were structured out there with little buildings. I mean, once the ship would arrive, it would come in. First thing they would do.
They would go to the Contagious Hospital first, and then they would be checked in, and the boat would be examined.
Exactly, and then they would kind of do an overview of not only the ship itself, but the crew, and make sure that everybody was okay to go to the next level, because this truly was the first stop before they hit a port.
Well, did they fumigate them? Did they really spray?
They did in some cases. It would be a review of the, it would be on the judgment of the surgeon of them to decide. It wasn't a one kind of spray for all. They kind of looked at it, because they also had to look at what they were bringing in. Because if it was a situation where they were bringing in something where the spray would hurt it, and it was not something where they felt there was a problem, it was at their judgment.
Well, could you walk from building to building? Was it
You
separate?
could. It was actually one big. You would basically look at it, and when you look at the model, which I think is great, and there is actually another model if you go over to the Maritime Museum that is really cool also, because it lights up and you can learn about each building as you hit the light. But yeah, it was all connected by one solid pier that you would kind of go from building to building. Yes, sir. I'm sorry.
Question, what became of ships or passengers or crew that, were any of them rejected?
Well, what would happen, or did you want to? Okay, I'll take that. What would happen is, once they did a review of it and found if there was a problem, then they would stay there until, obviously quarantined until they would find an issue. They have, from some records I looked at, turned ships away and would actually send them back to where they came from. That has happened, and that was at the judgment of the surgeon, and they would send them back where they came from. And some, it was very interesting. I read a story about a ship that was bringing in, and I think it was 1922, that came in, tried to come to this quarantine station, had a fever on board. They sent it back. It tried another 2 quarantine stations in different ports, Charleston and one in Virginia. Both of them sent them back too. But so yeah, it was a situation where they had to really, it was that protection we needed.
One of the first ships that went through the quarantine station actually was at the station for 4 months. So that shows how much of a process it was to actually take care of
But
this
these
disease.
period diseases, they were largely treatable?
To an extent. I mean, one of the biggest things that started, as you said, contagious, yellow fever in the late 1800s is probably the big factor that led to these quarantine stations that were coming in. This fever was coming in on ships. So that yellow fever was really the catalyst for the whole quarantine station.
You mentioned the spray.
It's like
how do you treat this?
it was more like a bacterial spray. It was like a mist. As I read about it, it didn't say a whole. Can you answer that?
Yeah.
Cool. Introduce yourself first of all.
I'm Kristen Phillips. I work at the Maritime Museum. We've been doing a lot of research on quarantine history as well. And it's fascinating because of the types of chemicals they were using that you think of today are terrifying. One, there was a mixture of formaldehyde, chlorine gas, sulfur dioxide.
Wow.
They used carbolic acid, which a lot of people overdosed on. There was actually a case where a steamship captain overdosed on carbolic acid, was taken to the quarantine station, and they found out he had enough to kill 10 men in his stomach. And it was used as an antiseptic for surgery, surgical instruments, and things like that. But these were used to fumigate the fabrics, the cargo. I believe they had a ballast dump there, so they'd actually have you dump your ballast films off, and before you could go up too. And I think about all I know as far as chemicals.
Yeah,
Enough.
yeah, it's enough to know it was various types, but yeah, it was, you understand in those days, I mean, some of the things they threw at us was,
What about the flu epidemic where they had like the mass grave in Wilmington? and stuff?
that's the yellow fever.
That was yellow fever. Okay.
And again, you can go into our cemetery and kind of date it as you walk around. We have a lot, and unfortunately for us, it seemed to hit children more than anything.
Where
We
were
lost a
these
lot.
ships coming from?
They would be coming from the Bahamas, from Europe. They were coming anywhere from overseas. That was the first stop you had to do, regulation-wise, was when you were coming from a foreign port, you would have to hit one of the quarantine stations.
How did the staff protect themselves from catching this disease?
That's always,
Dr.
that,
Dosher.
yeah, well, obviously, you know, from when he was in the war, that's a situation, he got tuberculosis there. But, I mean, I've seen some pictures of, early on with the mask and things like that, but, you know, again, I don't think they really had a whole lot to work from. They really just did the basic, same thing they would have done at the hospitals at the time. They were using the same methods to just kind of make sure they didn't get anything on them, from them. There were a lot of places to wash, from what I understand. They had a lot of water in all these buildings to do a lot of washing. The water tower was very important because they did a lot of washing.
Yeah, but they'll think of what they were putting in the water.
It's filtered by now. Yeah, we never have that problem. Yes.
I have a question, Lexi. When they would take out the tonsils, like in a big group, would Dr. Dosher use them for fishing?
No, that was, no, don't laugh, that is actually been, we have a tour that mentions that, and that is not,
That person is rather
that is,
entertained and educated.
that is an entertainment story, because I heard that myself recently, and I went to ask my father, who, as I said, grew up with Dr. Dosher, and after the shocked look on his face that I got, he said, well, I lived with the man till he died, and I was 12 years old, so for 12 years I lived with him, never saw him with a fishing pole. So I got that answer straight from someone that would know.
My wife and I volunteer at Dosher, and for about 6-7 years we've been taking care of the plants in the hospital. And a few times, about 3 or 4 times, we've had the opportunity to be on the float in the 4th of July parade in recent years. And in these times with insurance and costs and all kinds of medical issues, when that float goes by, people clap.
Well, first and foremost, I think you've mentioned that you volunteer. And I think that's an example not only with Dosher, but this community. I talk a lot about how much we appreciate our volunteers and our quality, what it is because of the volunteer hours that they do. And Dosher is a prime example of 10 to 15,000 hours a year are done in Dosher volunteer hours. So
It's
I
actually
know.
more than that, Randy.
Is it
28,000?
My gosh, and that's just Ann Hollingsworth. That's just Ann.
I resemble that remark.
Exactly. That's what she told me in between the tip of her hat.
I resemble that.
I have 2 questions.
Yeah.
When to get to the quarantine station, is that after the river pilots had gone out to the boat and brought
Correct.
So the river pilots were risking their lives, not just but also being
Because they would
exposed
have,
to
well, it
disease.
depends, because sometimes with river pilots, they not always had to go on the ship to maneuver it in. Sometimes they would just direct it through. Not at all times did they have to go on physically.
Oh, I thought there was like a ladder they climbed up.
That all depends on the type ship and if they
Okay.
needed to go on board or not.
Okay.
Sometimes they just directed through the shoals and through it. They not all times had to go.
Okay. And then my other question has to do with Dr. Dosher. I understand he trained some of the midwives.
He did.
Could you just talk about that a little bit?
Sure. He, as a community hospital, you relied on a lot of different people to wear different hats. And one of the things he liked to do was train the residents and different people. Would you want to talk about, Lisa, pop up here. I want you to talk about one of our African-American midwives. I think it's a great story, and I'll preface it with we have a wonderful new African-American display at the Visitor Center in the Garrison House. If you wanna.
I think Randy's given me a little more credit for that particular story, but yeah, Melissa Jackson was an extraordinary woman, not just with the work that she did with Dr. Dosher, certainly for that. She was responsible for facilitating a lot of births in the African American community, and really being a leader, I think, especially as a strong female in the community. And she had a lot of firsts in the African American community, and she was really a pillar. And so she was critical to a lot of the health and wellness and well-being in the African American community during the time that she served. And
she was trained by Dr. Dosher. She was one of the midwives that, because in a lot of cases that they would do the birth at the hospital, but in most cases they would do home births. So they would train these midwives to go out into the community to, again, this is county hospital. This was where people that needed to have help in Charlotte, needed to have help in Barnum Town, wherever it may be, they would still have a unit of the hospital that would go out and do, as we go from horse and buggy to the Model T, but they still went out and took care of the community from there. Still, house calls were good up until, I would say from my research, the last one I could find any information on was in the late 30s.
This is actually a newspaper article in 1932 of Dr. Dosher going to a house call. Yeah.
Were you
born at Dosher?
I was, in fact. Linda, were you born there?
I was not.
You were not?
I was born in Raleigh, but I got here about 18 months old.
Oh, okay, because Linda's about the age that was the last group oh no, I'm now gonna. I was before that. I'm gonna throw you under the bus. The last children born there were probably in like 1966, 67, were the last time they did any births in Dosher. They quit after me. I never understood. Maybe that tells you something.
perfection?
I'll tell you though that in my preteen years is that Julie Harrelson had a group of us, and we maybe about 12 or 13 of us that she taught to be candy stripers. I've still got my candy stripers.
Oh, you do?
That's cool.
We were it was back in the 70s, and we were in the old hospital. I can still smell the radiators down the hallway. And one of the fascinating things, and you can go in the hospital now and you can see it, is that the portrait of Dr. Dosher, no matter where you walk, his eyes. I remember everything. I was like, that's kind of wild.
Yeah, that is wild.
Did you say that he was a blockade runner before?
His father was.
His father
was Julius Dosher.
Okay.
So that's kind of how we think he acquired some of his money that was able to send him to medical school. Yes.
So have any of Dr. Dosher's descendants followed into medicine?
Well, a few of my sisters have, Jansen, my sister closest to my age, she's in the public health. So she just graduated from ECU 2 weeks ago.
Wow.
I have another sister who was interested in nursing, but not anyone that's really pursued a
Gal's a
doctor.
vet.
That's true. We have one as a vet. So yeah, there's medicine there. So yeah, but yeah, it's and as I said, I'm on the foundation because I believe that the foundation of this hospital, from the fact that it's a community hospital, is very important. And I have always been someone that says you have to put your money where your mouth is. If you want to see it continue, you have to be part of the process. So I have a meeting there tonight at 5.
Well, putting the money, a lot of people don't know the thrift shop on the corner. The first thing the women did were make curtains for the original hospital. And then they could buy golf carts and these intricate machines.
They're on the internet.
They put out millions. I mean, that's remarkable.
Yes, ma'am.
Robbie is a Dosher volunteer.
Oh yeah, that's right. I forgot about that.
Very
We laughed. Yeah, Robbie, he's one of my brothers. He's quite the character. He works in the emergency room. He's a mess, but yeah, we. No, I didn't say he's my brother. And he is one of those people that when he gets in there, he has a ball with everybody.
I know your brother pretty well because I volunteer in the ER too, so he and I do weekend shifts. And
Yeah, isn't he a mess? He's
He's
our mess.
No, what's that saying about me though? Because he and I just like.
Oh, yeah, Robbie is one of those people that he gives up. He volunteering at Dosher is perfect for him.
Well, I'll tell you what, we whipped that ER into shape.
Yes,
The nurses just stand back.
Yes, yes, ma'am.
I have a question, but I also want to tell you that I'm a volunteer at Dosher too, and we have contributed $2 million.
Is it $2 million now?
Wow.
$2 million plus.
So my question is, was the original hospital at the current location?
The original hospital that was dedicated in 1930 is at the original location. That was taken down in the, I want to say 2003. The original part, which was replaced by what you see now. But the facing,
The sign, isn't the sign made from the bricks from the original
it
hospital?
is. In fact, they are. The sign out front is made with the bricks from the original. And if you go to Dr. Dosher's grave, which is in Northwood Cemetery, there's a wall around the family grave that is made from the bricks from the hospital.
Oh.
So, yeah.
Well, when I first moved here, I saw a black wreath on bricks at this place. They were tearing down the beautiful steps that had been the first entrance, and then I found out Dr. Joe Pat Hagel had put the wreath. So
It was a very interesting time when they decided to tear down the original hospital. I know a lot of people felt that it was the loss of a part of us, but again, I think the hospital's not truly the bricks that make it, it's the community that makes it. And those great doctors and nurses that take care of us every day. That's what makes Dosher. And you guys that are part of paying that tax and making sure that we're all have the opportunity to go 2 miles up and get taken care of no matter what it is.
And that choose to go there as opposed to out in the county.
Out in the county, it is. And I
all
know
across the bridge. I mean, that's,
exactly.
yeah.
We've got a great jewel in Southport, and we want to do everything we can to make sure we keep it. Yes, ma'am.
You said in the 1970s they wanted to move it out on 17.
And they actually built it
They
up.
ever used that building because it's
It-
always looked empty.
It was a
I
hospital.
mean, I went to a doctor there.
Yeah, it was an actual functioning hospital, Brunswick Hospital from 1970, I want to say 75, 76, up until 2000 plus,
So
yeah.
that was funded through.
That was funded through the county.
Okay.
It was a county hospital. It replaced, as I say, Dosher as the true county hospital, but it was health department situation, all that was out through that hospital. Any other questions, any comments? Yes, ma'am.
Who is Mary White? That's my maiden name, that's what I'm asking.
Mary White was, I think she was a teenager at the time, and she was actually lived on a blockade runner with her family, and she witnessed a lot of the first-hand accounts of the disease itself. So her and her family moved up and down the Cape Fear River from Wilmington to Southport. That's where they went. They didn't go anywhere else. And she talks a little bit about how that affected the community. You can actually find that the rest of her diary on Susan Carson's research room.
Okay.
So
And who was that? Good, thank you.
Mary White.
Mary White.
Mary White, yeah.
Thank you.
Yes,
Smithville District doesn't include St. James.
it does, one
Yes.
part,
Yes.
just one
East of
part.
Beaver Creek, yes.
Yeah.
How did that come about? I mean, it got everybody else.
Well, that's an interesting situation. Smithville, if you look at the geography, because I get this question when I speak to general groups about that fact that St. James seems to be broken up in a lot of ways. It's Brunswick Electric. It's got a lot of different. If you look at the true geography back when we were drawing the lines for different counties and stuff, that was kind of in the middle of nowhere. It was a situation. It was a lot of wetlands and situate marsh. So it was kind of that area that was kind of border for anything. They weren't, you know, I don't think they anticipated.
Yeah, it's almost surrounded by Oak Island.
Exactly, but they, well, yes, and Oak Island, of course, in that
Except
area
for
was
the
developed
211th.
from the intercoastal being built, because before that was part of, you know, up until the intercoastal was built, that area was part of, would have been part of St. James.
So is that
if you
cast
think
in
about
stone?
it. What's that?
Is the district boundary cast in stone?
It is, because basically people talk about it and say, well, can you include other parts of St. James? Well, if they voted to rechange the district and they wanted to add themselves into Smithfield and take that tax on, I'm sure Dosher would be happy. I just don't, that's not a message I'd like to give. I had too many great volunteers in St. James, I'm not gonna do that.
So how long was the quarantine station open?
It was open from the mid-1800s to 1912? No, that's not right. Wait, it's on my board. 1928. That's when the fire.
And do you think that was on purpose?
No, actually, I understand through, again, city gossip for, you know, we're not Mouthport for no reason. That there was a gentleman that was out there drinking one night and set it on fire in the mix of having a nice little drink or two. So it was an accidental fire.
So what did they do after that? Did they just let the ships go on up to?
Well, by then they had pretty much eliminated the main reasons they were doing it, which was, you know, the disease issue, which was what they were looking for. So once they kind of got that under control, they, you know, they were having to pay a staff to be out there, look at, you know, maintaining it. And you're also got to look at the fact we were going into the Depression and they had to make choices. So that was one of the first to go.
By 1912, there were no cases of yellow fever at the time, so at that point it wasn't really needed.
That's one of the reasons he was doing more hospital work instead of doing more work out on the quarantine station. They were just trying to make sure that they had something to offer.
How many people did Wilmington lose during yellow fever?
Ooh, that's,
like in percentages, was it like a quarter of the town?
I don't think it was that much. I think, do we have, I want to say it was less than like 14%.
Well, half of them had already evacuated.
Yeah.
But the ones that stayed there, that's why Oakdale was built. It was out in the country.
In the country.
Yeah, but I mean, they did have room in quite a bit of the city cemetery, but it was a percentage of the total count. But I mean, a lot of they had evacuated the town had.
Yeah.
They also didn't count the, they didn't do a census on the black population.
And that was a huge amount that died from
The total.
Great. Any other questions? Great. Well, I want you to feel free to come up and check out her whole board here, and we'll be glad to stick around and answer questions. And